So the theme of today's forum is essentially data everywhere. And kicking off, I've already introduced Dr. Rob Hosking. So Rob, over to you.
Data in general practice. There's lots of it. Now that we've got about varying amounts, 95 to 98% of general practices are fully computerised. So that's a large amount of information being collected every day, with 85% of Australians seeing a GP every year. And in my own practice, some of my patients I've been seeing for 28 years, we've been partially computerised since 1996 and fully computerised since 2002. And what we're noticing is that this hardware and software is starting to strain, and some of the records taking longer and longer to open. Much quicker than the old piles of paper, but still you can see that it's probably a sign that we need to upgrade our servers or update our systems when some of the records start to take 5 to 10 seconds to open, which is a terribly long time when you're waiting for them. The other thing is everybody wants our data, and it seems to be becoming very popular. The data offers benefits beyond one-to-one patient care, and it's making that highly valuable to governments, universities, private organisations, and to general practices themselves. Big data can allow for predicting rates of disease and identifying individuals at higher risk. The catch that has to be aggregated, analysed and reported in order to become information and knowledge. Raw data itself needs to be manipulated and managed. At the micro level, it's also valuable to the patient themselves. And that's what we're going to be talking about in this session now. So beyond the issue of ownership, who owns the data? The clinician or the patient? This is not new. Many patients believe they own their own records, while many clinicians will continue to assert ownership over patient information. The current sort of philosophy that we're working on is that the physical health record belongs to the healthcare provider. The information in it belongs to the patient or the consumer. In Australia, individuals have access to their medical records via freedom of information legislation, and many GPs are accustomed to providing patients with access to their information. And indeed, it's part of the accreditation requirements that we have systems in place to provide patients with access to their information. But up until now, that has been physical presence or printouts, and now we're looking at other ways of dealing with it. So we now also have the better capacity to collect, analyse and share data with these new technologies. And the technologies have made this question of data ownership less relevant, as patients now have access to their own information more readily. And this brings many issues and challenges, but also many opportunities. So many people will be familiar with the story of e-patient Dave as an example of somebody who used his own information to seek alternative help. He was diagnosed with very aggressive stage 4 metastatic renal cell carcinoma in 2007, and then he joined an online community to seek information because he was told that he was going to be palliative and he had 24 weeks to live. And then he started a drug after accessing further specialist opinion in an area of excellence in this field, and he went on to take interleukin-2, which wasn't widely used at the time, and went into remission 6 months after the diagnosis, and he's still going strong. He's now a global healthcare analyst and keynote speaker, and you can watch his talks. TED Talks are really quite interesting. He's not anti-doctor. This is the thing I think that a lot of GPs might feel threatened by this sort of approach. But he encourages the healthcare profession to work with what he calls the most underutilised resource in the healthcare system, and that is the patient. His mantra is, let patients help. So ePatients Dave touches on some of the benefits of patients having access to their medical information. Again, this may be different in America to our system, where we have GPs as the primary gatekeepers to access to specialised care, and perhaps we need to look at Dave's story in a different light as it would apply in Australia. So research on this topic has shown patients who have access are more satisfied with their care compared with those patients who receive care through their standard channels. They communicate more effectively with healthcare providers. They can spot errors with their medication prescribing records, which can then be rectified, improving safety. And they're more likely to utilise preventative services. Now, is this an effect of having access, or is it that people with these characteristics are those who are more likely to seek access? I'll let you think about that one. The harms and drawbacks of patient access. From a clinician's perspective, there's concerns about increased workflow for healthcare providers, privacy, confidentiality issues, medico-legal issues, reduced perhaps health seeking by patients. But is there evidence for this? There's a couple of references there which show reviews of 176 studies suggesting that patient contact time doesn't necessarily increase for the healthcare providers. There are moderate increases in email contact time, which I'm not sure it yet translates into Australia. There's no increase in telephone contact time, and only variable effects on face-to-face contact time. Although there are also other tasks required to sustain patient access, which may impact on clinician workflow. And they may be technical and also based on availability of the clinician. There were no reports of patient harm or breaches in privacy in these 176 studies. Healthcare providers definitely worry about medico-legal issues, but there's not been a lot of research in this area. And should we avoid patient access to this information for fear of medico-legal? No, we probably shouldn't. We probably should actually embrace it because, as we saw earlier, it may reduce problems where errors may have occurred if the patient hadn't had access. Similarly, there isn't a lot of evidence to suggest that it deters patients from accessing face-to-face care or making disclosures to healthcare providers for fear that family members will see the record. But I think these are issues we need to address when we're dealing with patients, talking even about the My Health record, their fears about other third parties and family members accessing their records. So the known issues, in summary, we've got the that healthcare providers remain concerned about patient access to data. And I think it's really a cultural change within the health profession. This is what we're starting to see. And if patients are going to get access to their health data, doctors are going to have to change their attitude to the idea that I know stuff and you don't. So there is I think, you know, there's a bit of a culture among some health practitioners who like to show their superior knowledge. It's a bit like, I tend to equate it back to the, I mean, it's extreme, but back to the days when the clergy used to preach in Latin to English-speaking people. It's that sort of level of, I know stuff and you don't, just accept it. And we have to sort of get beyond that and start to, as Dave's, Brockhart e-patient Dave says, we have to embrace the patient and get them involved in the conversations more. It's a natural thing. It happens in every field. You go to your mechanic with your car and they'll start speaking to you about stuff that you have no idea about, and they know that, and they're just showing their knowledge. And it happens everywhere you look. And we've got to recognise that then when we're talking jargon, talking Latin. And while highly engaged patients like having access and take advantage of it, not all patients are going to be in this category as well. We've got to remember that this is not going to be for everybody. So the future, with the advent of My Health Record, we're moving towards a future where many patients have electronic record. The majority will. There are issues to be worked out. More engaged and informed patient base is likely to have benefits for medicine. However, I suspect that it's a bit like when we counsel patients about making evidence-based lifestyle changes like smoking cessation. A small number actually act on it immediately. Some may act on it later, and many never do. This may be the same with access to their medical records and medical data. I've got patients who are very highly switched on, very computer literate, and very enthusiastic about the My Health record. And when they come in, I say, "Have you looked at your My Health record recently?" And they go, "No." Now, that's an example that I find that frustrating because I'm sort of an advocate and pushing it, and yet there are still patients out there who don't yet see the benefit themselves. And this session we're going to talk about in a bit more detail. As with other industries like travel, retail and banking, medicine's becoming more consumer driven. So, the challenge is that it's a focus about, this is about consumers, my data, my record, my choice. It's about the consumer or the patient. So the My Health record, as we've heard, is the current national system that we have for access to patient data. It's allowing consumers and carers to access and aggregate their data and make more information available for them. And these are the words from the RACGP position statement on My Health record, that we support the appropriate use of de-identified My Health record data for public health purposes. And so now we're going to go and move on to have a panel discussion about patients' access and use of their own data.